Hello everyone. Today we are going to learn about the topic on care of pressure ulcer.
I am Minoli, tutor of Triple M College of Nursing.
Let's see what are the objectives we are going to discuss in this session. The first one is the introduction about the care of pressure ulcer and what are the risk factors the patients getting pressure ulcer and pathophysiology, complication and the common sites of the pressure ulcer and the stages of the pressure ulcer which involve the four stages and treatments plan for the pressure ulcer and nursing role of the pressure ulcer. Finally coming to the conclusion. What is a pressure ulcer? A pressure ulcer or pressure sores or decutated ulcer or bedside is localized injury to the skin and other underlying tissues, usually over the body prominence, as a result of prolonged and relieved pressures on the skin. Coming to the risk factors. People are at a risk of developing a pressure sores if they have difficulty moving and are unable to easily change the position while seated in a bed or a chair. And immobility may be due to the one of the risk factors of the bed sores. So the first risk factors are the friction. What is the friction? The friction is the resistance to motion. It may occur when the skin is dragged across the surface and such as when change the position or care provider moves the patient. And second was a shear. Shear means which shear occurs when two surface moves in the opposite direction. It may occur. And third, impaired sensory perception. So here, for example, spinal cord injuries, neurological disorders and loss of sensation. So these kind of the people may have impaired sensory perception, so may develop the bed sores. And impaired physical mobility due to some other loss of things, physical mobility, or maybe if patient is unconscious or coma stages, prolonged bed treatment, so they may get the bed sores. And altered level of consciousness and fecal and urinary incontinence. So here some bacteria from the fecal matter can cause the serious local infections and lead to some life threatening infections which will be affecting the whole body. So and final one is the malnutrition. So the malnutrition, for example, the people need enough fluids like calories, proteins, vitamins and minerals in their daily diet to maintain the healthy skin and also to preventing the breakdown of the tissues. And dehydration, one of the risk factors, and excessive body heat, okay, and advanced age. For example, the skin of older adult is generally more fragile and thinner and less elastic and drier than the skin of younger adults, so the easily chance to get the skin bed sores. And final most one is chronic medical conditions like diabetes and cardiovascular diseases can get the chance of the bed sores. Pathophysiology. Here the various risk factors act on areas of soft tissues overlying body prominence. So when this pressure exceeds normal capillary pressure, so which will be developing occlusion and tearing of small blood vessels, so which leads to reduce the tissue perfusion will happen. So finally it will be developing the ischemic necrosis, so the bed sore development will be starting. What are the common sites? The patients easily getting the bed sores like elbows, inner knees, and greater trochanter place, inner knees, heel, and hip places, and elbow, shoulder, and back of the shoulder, and back of the head and cars, lower back, and buttocks. These are the areas is usually first developing the bed sores. Stages of bed sores. Staging systems for pressure ulcers are based on the depth of the tissue destroyed. So based on the depth, there are four stages of the bed sores are there. One is stage 1 and stage 2 and stage 3 and stage 4. Totally the four stages of the bed sores are categorized. Stage 1 pressure ulcer, non-blanchable redness of intact skin. So intact skin presents with a non-blanchable erythema of a localized area, usually over a pony prominence area. So with this discolorations of the skin, sometimes warmth, edema or pain may be also present. And the stage 1 indicates at risk of the persons and which will be involves only the epidermis layer of the skin. Stage 2 partial thickness skin loss or blisters. So here the partial thickness loss of the dermis presents as a shallow open ulcer with a red to pink wound but without the slouch. So the stage 2 is damage to the epidermis and the dermis. So in this stage the ulcers may be referred to a blister formations or abrasion. Stage 3 full thickness skin loss, which means a fat visible. So the stage 3 ulcer is a full thickness tissue losses. So subcutaneous fat may be visible but bone, tendon and muscles is not exposed. Epidermis and dermis and subcutaneous tissues will be involved here, and the subcutaneous layers has a relatively poor blood supply, so it's difficult to heal. Stage 4 is a full thickness tissue losses. So here the stage 4 is the deepest, extending into the muscles, tendon and even the bone also. So full thickness of the tissue will be lost with the exposed bone, tendon and muscles will be losing. What are the complications can be seen after the bed sores development? So it may be complicated for cellulitis and bone and joint infection and sepsis, and finally it develop cancer. Treatment. So first, repositioning the patient. Changing the position oftenly and carefully follow the schedule for turning and repositioning to approximately every 15 minutes if in a patient wheelchair, and at least once every 2 hours when it in the patient the bed. So if unable to change the position in one, a family members or other caregivers must be able to give the do the help of the patient. And the next one is using the support surface system. So here these are the special cushions, pads, mattress and beds that relieve the pressure on the existing sore and help protect the vulnerable areas from further breakdowns. Third one is a cleaning. So here it is essential to keep wounds clean to prevent the infection. A stage 1 wound can be gently washed with the water and a mild soap, but open sores should be cleaned with the salt water like a saline solution each time the dressing is changed. And fourth one is applying a dressing. So here the dressing promotes healing by keeping a wound moist and also to creating a barrier against some infections and keeping the surrounding the skin will be dry. And this dressing choices like includes a firm dressing, gauze dressing, gel dressings and foam dressings and treated with a covering. So many types of dressings are nowadays available, can be go for it. And removal of the damaged tissues, which means a debridement procedure. So here to heal the properly wounds need to be free or damaged. So here dead or infected tissues will be removed. And surgical repair, it involves cutting away the dead tissues. So it has three types of debridement are available: mechanical debridement and autolytic debridement and enzymatic debridement. So the mechanical debridement in this loosens and removes the wound debris. So this may be done with a pressurized irrigation device, and low frequency mist ultrasound or specialized dressings are needed for this procedure. And coming to the autolytic debridement, here it enhances the body's naturally process of using the enzymes to break down the dead tissues. This method may be used in smaller uninfected wounds and eventually involves special dressings to keep the wound moist and clean. And the third one is the enzymatic debridement. Here it will involves applying some chemicals like enzymes and appropriate dressings to break down in the dead tissues. Then pain management. Pressure ulcers can be painful, and non-steroid anti-inflammatory drugs such as ibuprofen and naproxens may be reducing the pain. And antibiotics also to required for the patients if infected pressure sores that are not responding to the interventions may be treated with some topical medications or oral antibiotics is required to treat the bed sores. And then final most one the healthy diet. So here to promote the wound healing, the doctor or dietitian may recommended an increase in calories and fluids, a high protein diet, and increasing the foods in the vitamins and minerals to be helpful to healing the wound. Is the nurse's role? So the first, the assess the client for the predisposing factors for bed sore development and to skin condition at least twice a day to monitor. And the nurse should inspect the each pressure sites and every day and palpate the skins for increasing whether it is warmth and inspects for dry skin, moist skin, and break in the skins. Evaluate level of mobility of the patient and evaluate circulatory status, for example peripheral pulses and edema to be noted, and assess the neurovascular status and to determine a presence of incontinence, whether patients having any fecal things or urinary incontinence, and to evaluate nutritional and hydration status, whether the patient is receiving a healthy diet or not, and note the present health problems, what is the patient's whether can able to mobilize or not, or patient should be in the bedridden positions, whatever it. Interventions for a patient with a decreased sensory perception. Here too, the nurse should assess the pressure points for signs of bed sores development, provide a pressure redistribution surfaces, and intervention for a patient with incontinence, like assess the need for incontinence management, following each incontinence episodes, clean and the dry the thoroughly the areas, and protect the skins with the moisture and barrier ointment, and interventions to the avoid of frictions and shear, repositioning the patient using a draw sheet and lifting of surfaces, use a proper positioning technique, and avoid the dragging the patients in bed, and use comfort devices approximately, and interventions for a patient with a decreased activity and mobility, establish the individualized turning schedule should be there, and change the position at least once in a 2 hours and more frequently for the risk individuals, and interventions for the patients with the poor nutrition, like provide adequate nutritional and fluid intake and assist the intake of as necessary, consult the dietitians and for the nutritional evaluations, and to evaluate the ulcers progress for every 4 to 6 days and assist the physician or a surgeon in the deployment areas, and educate the patient and family regarding the risk factors and prevention of the bed sources. Hope you all understand about the care of pressure ulcer, and thanks for watching and keep subscribe our channel.